Hello, my name is Dr. Martin Kittel, and at the time of this recording, I'm the sole surgeon at Thames Valley Surgical Services, so I will be performing your minor surgical procedure. What do we remove or repair? You might have found us in the website and might know it already, but for the ones that have had a personal recommendation, we have got a website, www.minorsurgery.co.uk. Have a good look there. Generally, as an outline, it's lipomas, cysts, moles, skin tags, xanthelasmas, which are the cholesterol deposits around the eye, milia, and a variety of other skin lesions. We also repair earlobes. We offer a variety of surgical methods. The classic one that you probably know is the one where you have a cutout and then you will put some sutures in and the sutures come out a few days later. But we also do shave excisions where you don't need suturing, and we do a variety of heat destruction methods like electrodesiccation or cautery, and we can advise you on the day what method we think is the best. Again, in the end, the decision is yours, but we will give you advice. Every surgery will leave a scar, but some scars, for example in the face often, are almost invisible. So if I cut myself shaving, you usually won't see it, whilst other scars can be more pronounced. Scarring largely depends on your genetic makeup. Other factors that can be influenced is, for example, your vitamin D levels. Other things that you can use to influence good scarring we've listed in our pre-surgical advice sheet and also in your aftercare advice sheet. So if you already have a few scars on your body and you think you scar well, then you're likely, when we do a procedure, for you to scar well as well. If you've never had a scar, then most people will still scar well. But yes, there is the occasional one who suffers of keloid scarring. It's a genetic disorder, we think. And if you suffer of keloid scarring, then the scars can be sometimes thickened and more pronounced. If keloid scarring is something you're already aware of because of previous scarring, please tell us in the consultation. It's very important because then I can advise you much better about it. But as a summary about scarring, again, most people scar very, very well, and we rarely have problems. All surgery can have side effects, but the big three are infection, bruising, and the sutures coming apart, called stitch dehiscence. Infection can largely be avoided by me working clean and by you looking after your wound. And if you do think you have signs of an infection, to come early and get some antibiotics. Bruising can be avoided by not doing too much too early and by just sitting down after the surgery, perhaps if it's a bigger excision, putting some pressure on the wound. Sometimes I say to you, just hang around for half an hour, watch the aftercare video and put a bit of pressure on. The sutures coming apart can also be avoided by you not rubbing it with a towel, but just by dabbing it dry and keeping it covered for a couple of days. Sometimes you may have to come back to us. For example, a stitch remains and we have to take that out, sometimes under local anesthetic, or some little cyst might remain where we have removed a much bigger cyst and couldn't see that little baby cyst and things like that. But most of the time, it'll be once that you attend and then perhaps for the suture removal. Also during COVID, we have given a lot of people stitch removers home, and most of the people have found that very useful. So that's something we may offer to you. Then there is some rarer side effects, and I've tried my very best to list most of them in the pre-consent form. But we're only human, and sometimes even I can't appreciate that side effect, or I've never seen them in my 10,000, 20,000 procedures. So forgive me if I haven't mentioned a side effect and it occurs. We're all only human, and we can't foresee everything. Most minor surgical procedures are incredibly safe, but to keep you safe, we send most things to the laboratory. We can avoid that cost in some cases, for example, where you have multiple lipomas, or it's been there for 10 years and your GP and everybody has reassured you, or you have had a scan on it, or so on and so forth. And in that case, we'll let you sign a disclaimer form that shows that we've made that decision together. Other lesions like cysts and moles should usually go to the lab, so we make 100% sure that everything is kosher. Next, I talk a bit about the process. So you might already have completed your application form. If not, do it soon. It's very important for me that you complete it as good as you can. The pre-consent form is important for your own education and for me to know any allergies and so on and so forth, for you to know all the things that you need to know and that I need to know. So it's quite educational. Again, if you want to write down a few questions, feel free to do so. Following your consultation, we send you a final consent form, possibly a lab disclaimer form. We'll definitely send you your quote, and we'll send you anything else like an appointment, anything you still need. In terms of cost, now costing is really difficult, but we try to be really transparent. Some things are fixed costs, like let's say, for example, the classic is an earlobe repair or lipomas on the arms or the legs. They are very standard pricing. Many other things, like for example, a large lipoma on your back or a deeper lesion in the face, require more bespoke pricing. And in order to be well informed, you really need to read all the bits of the price list. Otherwise, you can't make yourself a picture how much it might be. And that's it from me. Thank you for listening. And I hope that you've got a few questions ready for me when you see me at the appointment. And I'm looking forward to seeing you soon. And then we'll take away what bothers you. Thank you and goodbye.